I think generally the preparedness and response has been good. I keep saying I've been to several of the COVID-19 the EOC, the Emergency Operations Center meetings, and sometimes they are there till 10:30 in the night. That shows commitment of the people who really want to work. With the minister going through every item, I think the preparedness has been good. I am hoping that the measures that are put in place, like the mobile vans and the other static points where COVID can be tested, beefing up the call center, because I think GTT has offered their call centers as well, beefing up the call center, having people trained, having people in the field to allay people's fears in terms of COVID-19. I think those will go a long way, and I think government has done fairly well with that. My fear is if we have this rapid rise and the system is not robust enough to withstand that. And I'm hoping that the measures like the curfew and good social responsibility, personal responsibility that we take will help us flatten the curve so that we don't have to go to that 20,000 and be overwhelmed. Private hospitals and private labs, if any, are private, and they are for profit, and therefore, as Paho, we don't give them donations. We give donations to government, and it's up to government to then give to private practitioners. To the best of my knowledge, no private entity has been prevented from doing testing. If they have the PCR machines and they have the primers and the probes that are used to test, they are at liberty to test. It's my understanding that private establishments don't want their establishments to be contaminated. Because if you are a COVID person and you come there, some of them feel, well, they will know that COVID person came there and therefore is contaminated, I don't want to go there. And therefore, even there are some that still do not write proper referral letters to patients that they see that may be COVID to go to GPAC. They just ask them, take a taxi and go. We don't do that. So I think it would be a good thing if private entities now get on board and with testing. And my only caveat that I will add is, if private entities are going to do testing, then there must be some quality assurance attached to it, so that we don't have persons testing and giving false positives or false negatives. So I think private entities have done very well in the past in many areas, and therefore we will encourage them to do that. But they will have to source their own primers and probes and reagents and all that, and the PCR machine, which I think some of them have the PCR machine already. They just have to get the right primers and probes. In terms of training, we are prepared to train as many persons as possible. You all know, and I know that there is a shutdown of almost all airports, and therefore the virologists who we got from Washington will not be able to come. But the training can be done from the people who are trained at the reference lab, plus the virologist online to guide them. And I am prepared at any time to facilitate such training so that private entities can come on board.